Kathryn's research investigates new ways of tracking infectious diseases and detecting emerging outbreaks. She's currently a professor at George Mason University and the author of 2 textbooks on global public health. You've written a global health book, which I find fascinating from the standpoint of this story, which is, we sort of know the beginning, we don't know the end, we don't really even know if we're in the middle. How do you write something like that, or are you writing as you go? Because this is obviously going to end up in the next edition.
Yeah, so global health is all about context. So we look at things like, what are the social factors that might be contributing to disease? What are the environmental factors? What are the health systems factors? So whether that's where are the hospitals, how are doctors trained, what are policies about how we import medications? All of that context goes into trying to understand how we prevent and control diseases. So the particular diseases, obviously with emerging events, that we have new things all the time, the particular diseases change, but the patterns that we see are ones that are relatively well understood.
The disease is changing. I mean, obviously it's a virus. We learn more with each passing day, I would assume. So what have you found really interesting about this? And what more are we learning, and how much more do we need to learn?
Coronavirus disease has been a little unexpected. So up until maybe a week into February, it was following the pattern that we expect based on things like SARS or other emerging infectious disease events. So up until that point, it was following the expected trajectory. What's changed now in February is that we're still seeing this big hotspot in the Wuhan area in Hubei province, but we're not seeing local transmission outside of that area yet, and that's unexpected. So we're not quite sure what's going on. A lot of the models that we were using earlier that are based on looking at historical events don't seem to be working right now. We shouldn't be seeing as many cases in China as we're seeing without seeing the geographic footprint increase.
In mid-February, the WHO convened a meeting of health experts to target where more research was needed to better understand the coronavirus. For now, many questions remain unanswered.
China reported 13,332 clinically confirmed cases in Hubei province.
Talk to me about the spreading of the virus. I guess every virus is different, but in this sense, how easily is it transmitted? How is it transmitted? Do we know those answers?
We still don't know a lot about how it's transmitted, and that's frustrating when we're more than a month into the outbreak. And that's not the fault of scientists or epidemiologists or public health officials. This is just a confusing virus in the way it's presenting. So we're seeing one situation in the heavily affected areas near Wuhan. We have that cruise ship outbreak off the coast of Japan, where we're seeing the timelines there and the potential transmission be different. Maybe, and we're seeing these little stories from other countries as well, where in some cases, it's very clear that it's a spouse who was infected by a partner, and that makes sense that they're sharing very close airspace. In other cases, there is some concern that this could be potentially spreading environmentally, probably not in a mass aerosolization thing. So it doesn't look right now like if someone was riding on a subway car, that infected person would put off so much virus into the air that it would infect the whole car. But maybe there's the ability for it to go room to room on a cruise ship. We don't know that yet. I haven't seen good numbers coming out from that episode where there's a map and we understand the ventilation system. But there is concern still that this could be spreading in ways that don't necessarily fit what we've seen with previous outbreaks like this one.
You mentioned previous outbreaks, and clearly history's always a help in a sense. But again, if it's different, it's new terrain. But you know a lot about SARS and MERS and Ebola. What are some lessons from those that you think are transferable to this? Or how does that help you look at it and help you assess what's going on?
Yeah, so when this coronavirus first started, epidemiologists all said the closest model we have is SARS. So we're going to build some models that are going to project what is the best case scenario or what is the worst case scenario with this based on SARS as a baseline model. As we get more data, we're going to add that to the model and we're going to improve the model. And we really thought that a month in, we would have a pretty well-refined model. That's just not what we're seeing yet. This appears to have a quite variable range of incubation periods from 2 to 14 days. That complicates the modeling. We've got a lot of cases which suggest that there may be various modes of transmission instead of one very clear, you have to have been within 2 feet of an infected person kind of scenario. So instead of having our models get more narrow and focused, it seems that we're almost adding more uncertainty to the model with some of these new numbers that are coming in.
So far, this new coronavirus is not as deadly as other coronaviruses, such as SARS, according to the WHO. 80% of patients have a mild form of the disease and recover. 14% have a severe form, including pneumonia, septic shock, and organ failure. In 2% of the cases, the patient dies.
There are some people who just shed virus more than other people. And we don't fully understand biologically why that's the case. We see that with other infections, that there are some people who may have no symptoms at all, but who for some genetic reason are able to shed that virus more readily than other people. What we're worried about with this is not the super spreaders. What we're worried about with coronavirus is the people who don't have symptoms who may inadvertently be infecting other people. So a super spreader, as far as a storyline, that's obviously interesting that we can track one person infecting people in different countries, but it's the people who don't know that they're sick, who aren't then staying home, who aren't taking precautions. That's what we're going to worry about with this. And it looks like we do now have people who have symptoms that are very mild or no symptoms at all who are testing positive. There's some possibility that that's a laboratory thing, that maybe we've got some false positive results. We are still trying to figure out these diagnostics for a very new pathogen. But there's some possibility that we have a lot of people who have a mild infection who could be infecting people very unintentionally.
The WHO designated the coronavirus outbreak a public health emergency of international concern, meaning the event could be a risk to other countries and may require immediate international action. As of now, the outbreak has not yet been elevated to the designation of pandemic.
And words, of course, matter. We're talking about an outbreak, but at some point, words like epidemic, pandemic. Walk our audience through what needs to happen before we start associating different names with the coronavirus.
So an outbreak is a local event. If there was, say, a picnic and people got sick from it, so it's not very widespread, we'd call that an outbreak. An epidemic is when there is a relatively widespread set of cases happening, but it's still contained geographically. And then a pandemic is when we start to see cases on multiple continents. So pan means widespread, it's geographic. That's not about this being a more or less severe disease, that's purely based on location. So at some point, this will probably be declared a pandemic, and WHO will make that designation just based on geography. That, as of early February, had not happened, even though this had been declared to be a public health emergency of international concern. So the PHEIC, that FEIC designation, is about saying that there's a concern for the world community, but that doesn't mean that every country is affected. What that does mean, though, is that every country has started putting into place preparedness plans. And we've seen here in the US that the CDC has released very specific information about when people come into an airport, where would they be sent if they appear to have symptoms and they've traveled from an affected area. So we've got thousands of beds that are scale-up capacity that could hold quarantined people, and those plans are ready. And those plans were not made because of coronavirus. Those plans were made decades ago, and they're updated regularly because an event like this can happen at any time. But the CDC is letting people know that they are ready because they're anticipating that at some point we may need to put those plans into effect.
So walk me through things. Let's say I am exposed to somebody, you have it, I get it. And as you said, there are some people, we talked about how kids, it's not, obviously their immune systems are stronger in a sense. Older people, obviously, this is affecting them much more, in much more of a stronger sense. So walk me through this. If I get it and I'm elderly, what are some of the symptoms? Is it flu-like initially and then it kind of develops into a pneumonia? I've never really heard anybody kind of walk me through, oh my God, I got it. now this is what's going to happen?
So based on what we've seen so far, and again, this could change, the virus could mutate, it could just be that we get more data, but for right now, what it looks like is that people present typically with a fever. Not everyone has a fever, but maybe 80% would have a fever. About 60% would have a cough, and maybe also some muscle aches or fatigue. So it's quite generic. It's very similar to what we'd see with influenza. A much smaller percent, perhaps less than 10% of people have things like nausea or they lose their appetite, which are again things that are very similar to what we see with influenza. With this though, about 7 to 8 days in, there are some people who about, again, a week into symptoms, develop severe pneumonia. And so that's where we would have that acute respiratory syndrome, where it's a relatively rapid onset, serious pneumonia problem. Sometimes what we're seeing in the case reports are that people were appearing to get a little bit better, and then this pneumonia came and hit them as they appeared to be on the rebound. So that would be the typical case for a person who ends up with pneumonia, but most people don't get pneumonia. So we know that there are a lot of people who have no symptoms at all or mild symptoms. We know that a lot of people aren't sick enough to need to be in a hospital. But there is this subset of people who get that severe respiratory syndrome, typically about a week after onset of symptoms.
Some countries around the world have responded to the outbreak with varying travel restrictions. The United States, Australia, and Singapore are denying entry to all foreign visitors who have recently been to China. Russia also stepped in by temporarily suspending entry to the country by any Chinese citizens, banning them from traveling to Russia for employment, education, and tourism.
So many people see this as scary and unknown. And I think, given your background, you probably find this fascinating and really interesting. But should we be as scared as people are? I know you and I have talked about influenza and how many people die of influenza, and the flu hits us every year. Should people be as concerned as they are?
We typically don't worry about things like influenza because we perceive them to be normal. Now, we should worry about influenza. We should get our flu shots. We should take precautions like washing our hands, but it doesn't sound as scary because it's something that we are used to having every year. So yes, the coronavirus compared to flu because it's new is scarier. Right now, most people in the world are not going to have any contact with someone with coronavirus because their countries are not affected. But if it does come to other countries, I think that that's something we need to be very aware of, that for certain at-risk populations, the case fatality rate for this is higher than the case fatality rate for influenza. So we are trying to be aggressive to keep this from going to other places within China or outside of China.
And one final question. As you look at this, given the fact that this is something that you study, is there any way to project what we're looking at in terms of a timeline, how long this goes on?
Well, we know at this point it's going to be at least months. And we know that there are lots of people who are already infected that will become symptomatic in the next couple of weeks. Because again, we've got that timeline of when it's a week to onset of symptoms and a week till people are seriously ill after that, this is going to unfold slowly. So months at minimum, and that would be dependent on this not spreading to other countries. If this ends up being a pandemic, every new country that it shows up in is going to have its own timeline for trying to track the cases, to contain it. So that's going to really extend the global timeline until we would have this under control.
I know I said that was my last question, but I do have one other. China's efforts, the fact that they would basically quarantine an entire major city like Wuhan, try and keep it within the borders of China, and also trying to really kind of isolate it to Hubei province. What difference does that make in terms of, when we're talking about pandemics?
If China had not acted aggressively to try to restrict travel from the heavily affected areas, we would have had a pandemic by now. There's no question about that. Public health measures work. We have a lot of people who are saying, oh, we'll get a vaccine that's going to fix this. We always have this tendency to think that technology will swoop in and save the day. And technology does help, but technology takes time. And by the time we develop and test and manufacture a vaccine, that's months out, maybe years out. What we have in the meanwhile is public health. And that means doing the contact tracing, the quarantine, the isolation, and that really does contain things. So if China had not been, again, very aggressively trying to quarantine people and isolate as soon as we realized that this was a problem, we would have seen a very different situation moving into February, moving later into 2020.
All right, thanks so much.